Adams Archive.
There was a plane in Sao Paulo, Brazil, that went down very mysteriously, very weird way for a plane to go down. And there's some people that speculate that maybe it's because of the people that were on the plane. Do you remember the Titanic? There's this whole theory around the Titanic. The theory goes, if you don't know it, that there was all of these very, very powerful, rich people who were against the Federal Reserve, being created. Right around the same time that it was going to be implemented, these people were going to speak out about it. They were going to pour money into stopping it. They were going to do all of these things. Well, those same people went on this huge-ass cruise ship together, and that same cruise ship happened to hit a huge iceberg, and everybody died. That's weird. Well, similarly, with this plane crash in Brazil, there was multiple, I believe it was 8 physicians, 8 doctors that were on this plane at one given time going to a conference to discuss and release evidence linking mRNA vaccines to very, very serious health effects. Now, when you say mRNA vaccines, it's almost a misnomer because the mRNA technology was always a gene therapy. They literally updated the definition of vaccine to allow it to be considered a vaccine. The same way they did it with herd immunity, the same way that they did it with all of these other things, right? Orwellian, very Orwellian. So there's a video that you can watch on Rumble. It goes through about 15 minutes of it. Let's go ahead and watch this video from this article, and then we will talk a little bit more about it. Here you go.
That deadly plane crash in Brazil, killing everyone on board. The 2 black boxes, the cockpit voice recorder and the flight data recorder, they were recovered. This chilling video, it shows that passenger plane in a free fall from the sky. All 57 passengers and 4 crew members died. There's still no explanation as to why or how this happened. The head of Brazil's aviation accident agency says the aircraft didn't communicate any type of emergency before this crash. ABC's Allison Kosick reports.
This is the horrific moment a plane carrying 61 passengers and crew plummeted to the ground in Brazil, killing everyone on board.
Meu Deus, meu Deus, meu Deus, meu Deus.
The 2-engine turboprop from local airline Voapass spinning out of control and crashing into a residential neighborhood. Witnesses horrified. This man emotional, saying he was running late and missed the flight. Now grateful to the airport worker who wouldn't let him board. The flight taking off from Cascavel in the Brazilian state of Paraná, bound for the airport in Sao Paulo. Shortly before it was scheduled to come in for a landing, the plane dropping 17,000 feet in just 1 minute.
Usually this sort of thing occurs because the flight crew was not able to maintain or did not maintain enough airspeed. Clearly it was a stall spin. How they got into it is what we don't know.
The fiery wreckage, large parts of the plane smoldering in a residential neighborhood, debris littering yards. 1 person on the ground was injured. Brazilian aviation officials say the aircraft did not communicate any emergency on board. The focus is on examining those black boxes, the cockpit voice recorder and flight data recorder, which will be crucial in the investigation. Allison Kosick, ABC News, New York.
Brazil's president declared 3 days of mourning for the victims.
So there it is. Now, the idea here, I believe that there was 8. Let's go ahead and pull it up and see if there's any other further information about this from what we were reading. But that's a terrifying video. And if you know anything about aviation, that shit doesn't happen, right? Like, you don't just magically lose speed and plummet. And if you do run one of your turbines or whatever, your engines fails, you're going to tell air traffic control. I would know. I was an air traffic controller. You're going to tell air traffic control. They're going to tell you that this is happening, and here's what we have going on, and here's our plan, and here's what we recommend you do, and you should stop at this, this unmanned airport close to you, and you would help usher them to where they need to go. Now, from the comments here, it says, and they all decided to fly together and told others that's what they were on their way to do. You're saying this is the exact same conspiracy as the Titanic that was carrying men on their way to stop the creation of the Federal Reserve? Yeah, that's exactly what we're saying. That's exactly what I just talked about. It also says that Malaysia Air Flight 370 had a team of semiconductor experts on their way to reveal allegedly room temperature semiconductors. That's interesting. Very interesting. Let's go ahead and watch this. This is we'll see if there's any additional evidence here on the video that's linked. It leads you to a Rumble video talking about it. So let's see if we can, maybe we'll listen into a couple minutes about the conspiracy aspect of this here. Here you go.
And blowing the whistle on the devastating turbo cancer epidemic sweeping the world have been found dead. The bodies of 6 world-leading oncologists and 2 resident medics were found on Friday in the wreckage of a plane that plunged from the sky in Brazil and exploded in a fireball, killing all 62 people on board. The doctors were on their way to an international conference in Sao Paulo, where they were set to present their findings that mRNA and the COVID-19 vaccines are responsible for the explosion of turbo cancers and autoimmune diseases wreaking havoc around the world.
I would just like to state that I had no idea the word turbo cancer was actually accepted. I still don't know if it is, but that's a terrifying term. Turbo cancer. It's like Turbo Man. Turbo cancer. I'm gonna have to look that one up.
In the world today, mainstream media are working overtime to brush this story under the carpet on behalf of Big Pharma, but the facts are damning, and we're not going to let them cover up the truth. Before we dive in, join the People's Voice Locals community if you have bursting into flames. SC-2500 Vopos airline flight plunged from the sky and crashed into a gated community. The plane was at an altitude of 16,000 feet when it went into a death spiral and plummeted to the ground in 50 seconds. Eyewitnesses who caught the crash on video said it appeared to stall before circling to the ground and bursting into flames at around 1:30 p.m. local time. A total of 15 doctors were scheduled to take the doomed flight, but miraculously 7 had taken an earlier plane.
New information tonight on this haunting scene. A plane spinning slowly as it drops from the sky. Crashing in a Brazilian neighborhood near Sao Paulo.
The bodies will take a lot of time.
We are concentrating on providing specialized assistance from psychologists, social workers,
and are being transferred to the morgue in Sao Paulo, where they will be x-rayed and DNA tests will be done to identify them.
The 8 doctors who tragically lost their lives in the air crash include radiologist Lionel Ferreira and pediatric cancer experts Sarah Stella and Silvia Osaki. Eduardo Baptistella of the Regional Medical Council said, "Unfortunately, we received very sad news and were able to confirm the death of 8 doctors. The doctors were going to an oncology conference. These were people who dedicated their lives to saving others. Saving others for these oncologists involved warning the world about the devastating effects of mRNA vaccines and the skyrocketing rates of cancer around the world, including rare, ultra-aggressive cancers behaving in ways we've never seen before." According to a colleague, the whistleblowing doctors were set to present evidence to the world that the public were misled about the nature of the mRNA COVID-19 injections. The doctors on the doomed flight had concluded that governments and regulators must urgently recall the mRNA vaccines before even more harm is done.
We have all been warned to stop researching this area. My colleagues were told they must not, under any circumstances, bring this information to the public forum. But they chose to do it anyway. They understood the risks, but they did not expect the plane to fall from the sky. We now know that mRNA produces an uncontrolled amount of spike protein in the body because the N1-methylpseudoridine allows the mRNA to remain in the body for an unspecified amount of time. Moderna and Pfizer told us that mRNA would leave the body in a matter of weeks or months, but it doesn't. This is incredibly dangerous. This is a disaster for global health. We are seeing the results of this deception in real time around the world.
According to Dr. Makis, some of his young and healthy patients have died days or even hours after diagnosis.
There are only a handful out of the 100,000 doctors, Canadian doctors, that didn't take the vaccine that are still practicing medicine. So it's something like 99.9% vaccination rate. And they were the first ones to line up for their vaccines. Well, as I started looking at the sudden deaths of Canadian doctors, I realized, yes, most of them are dying from cardiac issues, heart injuries, cardiac arrests, dying while jogging or swimming, dying in their sleep. And Dr. Peter McCullough has talked about this extensively, about the myocarditis and the damage to the heart, the scarring to the heart. And then some were dying from blood clots, pulmonary emboli, strokes. But then there was quite a large subset of doctors who were developing extremely aggressive cancers. And cancers at an age that they shouldn't be getting. So, for example, there was a doctor who developed gastric cancer in his 30s, presented at stage 4, he was dead in less than a year. Very rare brain cancers in young individuals in their 20s and 30s, medical students, medical residents. And these cancers would always present at stage 4, and they would always kill them in a matter of a few months, and it was always less than a year. And, at first I didn't know, what the term for
Leadership, YouTube banned any content that questioned vaccine safety, while popular YouTubers...
Oh, that's interesting. The YouTube CEO that was hyper banning material about the shot also so happened to die of turbo cancer following her having all of the vaccines. That's interesting.
For banning what she called vaccine conspiracy theories on the platform, died after a 2-year battle with an ultra-aggressive form of cancer. Under Wojcicki's leadership, YouTube banned any content that questioned vaccine safety, while popular YouTubers with millions of followers were paid to promote the COVID mRNA injections to their followers. Pharma companies were desperate to use stealth marketing to brainwash the masses. Taylor Swift's boyfriend, Travis Kelce, received $20 million from Pfizer to push their deadly product. To put that figure in perspective, it's far more money than he earns playing football.
All right, so you get the point. That was the idea. These doctors were going to publish information, going to have a speech about this somewhere. 15 of them were going to. So I guess, what we should really do is dive into what did the other ones talk about when they arrived. If not all of these physicians were there should be some physicians that were at this conference that had the conversations that they were trying to stop them from having. That would be a good follow-up item for anybody out there and myself. Very interesting. So last but not least, we're just going to dive into this one, getting towards the tail end of this here, which is that there's a new global health emergency, says the WHO. What is mpox? Where are the outbreaks? And will the virus spread, says AP News. Now, you always have to be concerned about a virus when they rebrand it. Just like they rebranded, they rebranded a transsexual into a transgender. Right? As soon as they rebranded that, you knew some shit was about to go down. As soon as they rebranded mRNA technology into vaccines, as soon as they rebranded, COVID-19 from, every time they rebrand these things, something's about to go down, right? It's no longer monkeypox, it's mpox, because monkey implies that it's not going to kill you, it's going to kill monkeys. Right, monkeys implies that it aggressively transfers between monkeys and not humans, which is the case. If you go on Google right now and you type it, you need to bookmark it because it says it doesn't transfer easily between humans. It's pretty hard to have it transfer, and when it does, it's not that serious. Well, we can't have that, right? So, here it is. Let's go ahead and take a look at this article. Right, SARS-CoV-2, right? No, here we go. mpox, the new global pandemic. The World Health Organization declared Wednesday that the increasing spread of mpox, monkeypox, in Africa is a global health emergency, warning the virus might ultimately spill across international borders. The announcement by the WHO General Director Tedros Adhanom Ghebreyesus came after a meeting with the UN health officials. Here's the article for you. The African Centers for Disease Control and Prevention declared that mpox a public health emergency on the continent on Tuesday. WHO said there have been more than 14,000 cases and 524 deaths in Africa this year, which already exceeded last year's figures. So far, more than 96% of all cases and deaths are in a single country, the Congo. Scientists are concerned by the spread of the new version of the disease that there might be more easily transmitted among people. They're concerned about it, but they don't know. But they're going to tell you that they know so they can make money off of it. Right? It goes on to say, what is mpox? Mpox, also known as monkeypox, was first identified by scientists in 1958 when there was outbreaks of a pox-like disease in monkeys. Until recently, most human cases were seen in people in Central and West Africa who had close contact with infected monkeys. In 2022, the virus was confirmed to spread via sex for the first time and triggered outbreaks with more than 70 countries across the world. Mpox belongs to the same family of viruses as smallpox, but causes milder symptoms like fever, chills, and body aches. People with more serious cases can develop lesions on the face, hands, chest, and genitals. So that's essentially what you need to know is keep an eye on monkeypox because it might be coming to a locked down city near you. And it is an election season. Just saying. Just saying. It is an election season, and they will do literally anything to shut you down and get mail-in ballots to become a thing as it was last time. Now, do some research on that. But in the meantime, that is what I have for you, my friends.
Adam's Archive.